that the conversation we are having here today would be a very different conversation about Part D without the efforts of the man that I'm about to introduce, Secretary Michael Leavitt. Thank you very much.
We have chosen to live in a country where people are cared for when they're sick or when they are injured. And it is an ethic that we cannot allow to be lost in our country. It is something that is part of our ethos and the moral fabric of the nation. Having said that, there is a new entry into this discussion. And it is not one necessarily to diminish or cast less importance, but the new piece of this conversation is what I will call dispassion. Global economic dispassion. We're facing a new set of circumstances in the context of what will drive the healthcare debate. And I'd like to suggest that healthcare reform is no longer simply about what happens on Capitol Hill with the Affordable Care Act. Healthcare reform has become a question of economic policy. This is now an economic reform debate, not just a health reform debate, and that will drive this global economic dispassion will drive us as a country to do things that in the past might have seemed important, but necessarily didn't occur because we always had the capacity to add it to a debt structure that no longer, or at least is rapidly coming to a close in terms of our capacity to do it. So that's the first thing I wanted to say, is that we're in a new era. Part of the reason, the evidence that we can say that Part D worked is that it saved money. There's no dispute over the fact that if you take the estimates that the government actuaries created at the beginning and look at what's occurred, there has been a dramatic savings, and while there are many reasons that could be explained, it is underpinned by the value of competition in an organized market. This is a fundamental shift that was made from one-size-fits-all Medicare to Part D. We changed the role of government from being an organization that actually having a function of operating the system to one that organized the system. A fundamental difference, and it created savings. It became clear that it also improved quality. And may I just underscore a point here that will play a big role in my latter comments. Those savings are scorable. And my advocacy would be for the Committee of 12 to take a hard look at implementing changes in Medicare that will in fact drive change in the system. I'd like to just end by telling you the most important thing I learned in 4 years as Secretary of Health about health care reform. If you're going to reform the health care system, you have to change Medicare. It's the only system that pervades the entire health care environment. Every doctor's office, every pharmacy, every medical device, every clinic, every hospital have created, every insurance company, every payer has organized its system around Medicare. If we move Medicare toward an integrated care model with risk-based payment, the fastest way to do it is to use the lessons of Part D and to begin move forward. We'll have scorable savings, higher quality, better value, and the Committee of 12 can in fact make serious progress.